I do not think monkeypox has any ability to cause a pandemic because it is an inefficient transmitter, because it is not contagious during the incubation period. And the thing about it is the incubation period is long enough that if you can get to people after they've been exposed and vaccinate them, you can abort that infection from occurring. I do suspect we're going to see more cases in Canada and the United States. And that's because this monkeypox outbreak is a little bit unusual. It's not something that is attributable to contact with an infected animal or travel to an endemic region, but it's something that's spreading through social networks. There's a danger of viewing every further infectious disease outbreak through the lens of COVID-19.
However, the UK Health Security Agency warns severe illness can occur.
There are certain individuals who are much more at risk of severe disease, particularly immunosuppressed individuals or young children.
It can take around 12 days to show symptoms, and patients are advised to isolate until their scabs have fallen off. The outbreak of this strain amidst a global pandemic and the emergence of monkeypox in countries where it doesn't normally appear adds to the concern.
It seems genetically like it's the West African strain that's circulating. So now it's circulating within particular pockets and subpopulations, predominantly in urban areas, which is different from the natural epidemiology that's seen in West Africa, where it is more confined, more usually, to rural areas. And the interesting thing about monkeypox is that although we know a lot about the biology of the virus, we don't necessarily fully understand the epidemiology of it. So it's likely to be usually confined to animal populations and then to spill over into human populations. But we don't know what the animal reservoir is. But we know that human-to-human transmission is not usually the most important method of transmission. Yeah, so it's transmitted by really close contact, usually with bodily fluids. So that would be the sort of contact that you might have with somebody that is dependent on you for care, or with a close partner. So we're talking about really close and household contacts. We're not talking about casually walking past somebody in the street or sitting next to somebody on a bus. So I think that we should definitely have a message that nobody should be overly alarmed and nobody should be panicking. Obviously, good hygiene is important.